Hello, everyone. Welcome back to another session of A Day with your Fertility Specialist. I'm Joanna Damina, your host for today. Thank you for joining us. Thank you so much for your continuous engagement, every click, every like, every comment, every share. Thank you for being around. We love having you here. So today we have something interesting to talk about. So please make sure to share the link to this video, to this session, so you can have other people on board with us. Like I said, we love having you here, and we have something interesting to talk about. If you know someone that would be interested in learning more about fertility, you can share this link to them. Um, Sorry about that. As you can tell, I am quite new on this. You're used to having Miss Ruth over here, so I won't let my nerves get to me, but I will just continue to talk about. Today, we're going to talk about how fertility is affected by age, or how age affects fertility in men and in women. As we know, fertility is spoken about a lot in society based off of how a woman can, get pregnant. It's usually focused on women, and we don't know as much about fertility with regards to men. I have Dr. Olubi here,
Thank
Dr.
you,
Deborah
Joanna.
Olubi here.
Thank you.
Welcome. Thank you
Thank
for
you.
joining us.
Thank you so much.
Dr. Olubi is a family physician. She's a fertility specialist, an IVF specialist, as well as our IVF here at Alps Hospitals. So you see, we have an expert here to talk to us and to give us more information about how age can affect fertility in men and women. So please sit tight and let's all learn something new from Dr. Deborah today. Hello, Dr. Deborah.
Thank you, Joanna.
Yes, it's a joy. So before we start talking about, the whole fertility thing, can you tell us about how aging affects our body? We all know that we have certain related diseases. When we think about things like high blood pressure, most people think it only comes with age, and certain things that change in our bodies as we grow. So can you tell us more about that?
Yeah. So aging is it's something that happens to every living thing.
Yeah.
Everybody ages. Everybody gets older. So it's not something abnormal. It's a natural process. And you know that aging brings about some changes in our bodies as both as human beings, both the men and the. So it gradually leads to a decline in our physical and then mental function. So as regards fertility, aging has fertility. Yes, the way aging of men and women is different. Aging affects both group of people. As regards the timing, the mechanisms for the changes that occur, and even the severity, it differs in the male and in the female. So I'm sure as we go ahead, we'll talk more about the specific changes related to the different gender.
Sure, we're going to get into that as we go on with the session, but I want us to fertility. With this, we talk about a day with your fertility specialist. It's in the name already, but some people have certain ideologies about fertility. Like it pertains to women. That if you're young, you're fertile, or men are fertile for their whole lives. Like nothing ever changes with men's fertility. So can you tell us what it means to be fertile?
Yeah, so to be able to procreate, to for a woman to get pregnant, to have a child, for a man to be able to get a woman pregnant. So in a nutshell, that's what fertility is. So as regards fertility and aging, so let's look at the different genders. So like I said, aging affects fertility in both species, both males and female, but the timing is different. In a woman, there's a gradual decline in our fertility with age at a certain age. But in men, this decline takes longer to happen and it's more gradual. It occurs at a later age. So let me just talk about the woman. In a woman, aging affects fertility in different ways. One, it affects the number of eggs a woman has in terms of quantity of eggs, because aging affects the ovarian reserve. When we talk about ovarian reserve, every woman, every female is born with a certain number of eggs that she would ever have at birth. The body does not produce more. The body does not produce new eggs. But we know that with research now, so certain procedures can lead to the body being able to regenerate and produce new eggs. But as per nature, in the natural process, a woman is born with all the eggs she would ever have at birth, and the body does not produce new eggs. And these eggs, these numbers keep declining. As at the time when a woman enters puberty from around maybe age 12 to 13, she just has about 400, between 300,000 to 400,000 eggs left in her ovaries. And with each menstrual cycle, menses is one of the hallmarks of puberty.
Sure.
With each menstrual cycle, a cohort, a certain number of eggs are mobilized. They start to develop, but later it's just one that continues to mature, and is that one that is ovulated, all the remaining will decline.
So you're saying that the eggs that are released in a menstrual cycle,
Yes.
if they're not that one egg, if they're not that particular
No, it's
one
not just
egg.
one egg that is released by
No, I
menstrual
mean you
cycle.
say that there's
It's
this
just
one
one egg that is released, but you have up to
yeah,
about 1,000
exactly. So those
that
1,000
start,
that are
and that
released, they're
1,000,
gone
that
from that.
999 will die,
Oh,
and just
okay.
one is released. So imagine all the menstrual cycles that a woman
Has
has in her
throughout her
lifetime.
lifetime.
About 1,000 eggs are going
Mm.
from the 300 to the 400,000. So for a woman, by the
That's a
time you
lot.
reach about the age of 35, there's
Yeah.
a sharp decline.
I mean, yes, we've seen that in society.
Yes.
People talk about women's age and then they're like, oh, hurry up
Yes.
and have a kid, hurry up and do that.
Exactly.
Yeah, so we've
Yeah.
seen
So
that.
even people, they observe the natural process in
Yeah.
women, and we observe that a woman is most fertile in her 20s. By the time you're getting to your 30s, mid 30s, 35, there's a
The
gradual
decline.
decline. There's a sharp decline in the amount of eggs a woman has, and that will impact on her fertility. So fertility will also decline. So not just in the number of eggs, the quality of the eggs also decline. So that's why you see that with increased age, increased maternal age, women that have children, some of those children can have some genetic abnormalities, because a lot of chromosomal damages occur in eggs of older age women. So you see that miscarriages are more common in them. You see that infertility is more common. Is more difficult for a woman that's older in age, especially after the age of 35. By the
Yeah.
time you're getting to 45, this the
The
difficulty even,
chances,
the chances even becomes less. So you see that there's a lot of difficulty in getting pregnant in them, and then the children are predisposed to having some genetic abnormalities. Down syndrome is common with age, and other abnormalities in children
That's
like that.
that's a fun fact, by the way. In case you didn't know, that could be one of the things that you can look into, that you say, oh, okay, when a child has certain genetical conditions,
Conditions,
look
yeah.
into
The age
this
of the mother, yes,
yes.
it's common at that age. It's not as if we don't see Down syndrome
Yes, of
occurring in
course.
women that of younger
Younger
age,
ages.
but it's more older age. So chromosomal abnormalities are more common. So those eggs have a lot of chromosomal abnormalities at that age, and that's why miscarriages is also more common in them. Yes, and apart from that, because of the hormonal, fluctuations you have, this woman, because as you're tending to, by the time you're getting 35, going to 40, you're tending to what we call menopause.
Yeah.
Menopause is when the ovaries stop producing eggs. So there are some hormonal changes that happen at this stage, because the ovaries produce the majority female reproductive hormones, estrogen and progesterone.
Okay.
So
It's a
the
big word.
ovaries, yeah. So the ovaries, so it brings about some changes in
Mm.
the brain. It sends a signal to the brain. There's a hormone that the brain starts producing more of, what we call follicle stimulating hormone, luteinizing hormone. But the ovaries are not responding to this
To those
stimulus
things.
to
Okay.
produce eggs.
Okay.
Those hormones are releasing eggs, but the ovary is not able to do that because the reserve has been exhausted. So these high levels of these hormones bring about some changes in the woman that leads to decreased ovulation. So if you're not releasing egg, the chances of getting pregnant is low.
Low.
Yes, so
Course,
that's
yeah.
another way that aging affects women. And we know that aging also predisposes us to some medical conditions. A lot of some medical conditions, because like diabetes in pregnancy, gestational diabetes, preeclampsia. That's when you have hypertension in pregnancy, and then it's
Okay.
affecting the brain, the liver, the blood vessel, and other organs. And then even the genetic abnormalities we talked about. So all these are more common in older age women because of these changes that occur with aging.
So we've
Yes,
hit some very critical points
yes.
in, the age and how it can affect a woman's fertility. Can we talk a little bit more about men? I mean,
Okay.
people seem to think that
the men are spared.
Yes, yeah, fertility is limitless,
Exactly.
exactly.
Yeah.
So
Yeah.
can you tell us a little bit more about
Yeah.
that?
So for
Let's
men,
inform our viewers.
so men, the effects of aging on fertility is not as profound as in women, and it happens later on in life. We
Okay.
talked about a woman at about the age of 35.
35,
You
yeah.
already start seeing the effect, but for men, the effect happens later in life. So another thing before I think we need to know is that, the effects of aging is different. The timing of the effects is different for everybody.
True.
And it has to do with things like genetics, the kind of lifestyle you have. That's why you see some people, they might be 50 and you feel, oh, this man still looks young. But someone that is 35 is already looking as if, she's 50 years old.
Yeah.
So lifestyle, talking about the diet, is talking about stressors, and even the environment all contribute to how the effects of aging manifest in an individual. Yes. So, but for men, like I said, the effect of aging on fertility occurs later and it's more gradual.
Okay.
So because men, they are able to keep producing sperm throughout their lives. It's not like a woman that you were born with all the eggs you would ever have at birth, and this number keeps declining.
So there's kind of a limitation, actually. There's more of a limitation with women than there is
Exactly,
with
with
men.
women. That's why it's the women that people talk. Your biological clock is
Yes,
ticking.
exactly.
You need
that.
to know it's women. Yes, it's
even people
women.
that are not in the medical field will tell you your biological clock,
Clock
your
is
clock, your
ticking.
clock, like
Yeah,
that.
and
But
it's true. They're
yes,
correct.
true, it's
Yes,
true.
because that's how God has made a woman. There's really a biological clock.
that
There's a
goes
natural
by, yeah.
progression. Yes, exactly, especially as regards fertility. So for a man, the change you see later on in life, and then one of the changes you see is the quality of the sperms reduce, because older age men, the kind of sperms they produce are more tended to have DNA mutations, that's abnormalities in the DNA of this sperm. And this will also reduce the chances of getting a woman pregnant because these sperm are abnormal.
They need to be healthy for
yes,
us to
exactly, for
have.
fertilization to take place. And then the volume of the sperm also reduces. The volume motility is the ability of the sperm to swim, because
Oh,
the
okay.
sperm needs to swim to meet the fallopian tube and fertilize the egg for spontaneous pregnancy. So motility also reduces, volume reduces, and then you also notice with age a lot of abnormalities with the libido. There's decreased libido. Men tend to have a lot of erectile dysfunction, and all this too can affect fertility. And then with age, all that changes in the body that as regards aging, so they're more predisposed to having medical issues like hypertension, diabetes, and all that.
Sure.
So all that can also impact on the sperm.
So I'm curious about something. I mean, for women, we have this age of 35, right?
Yes.
Do we have a specific age for when
Fertility
fertility in
declines in
men?
men.
Yes.
Well, no specific age, but as a man is turning towards the 50s, fertility can start declining. But like
Oh,
I
okay.
said, lifestyle also impacts on it. So someone that has had an unhealthy lifestyle, even at a younger age, we see young men nowadays, a lot of them with even azoospermia. Azoospermia means no sperm cells,
Oh, okay.
because of lifestyle, because
Yeah.
lifestyle such as alcohol consumption, tobacco intake, unhealthy diets, all that can impact on sperm production and the
Okay.
quality of the sperm. Yes.
So-
And then you notice that because of these chromosomal abnormalities in the sperm, children, if they're able to get a woman pregnant or they are able to have children, these children have an increased risk of having some genetic abnormalities. Yes, things such as autism spectrum disease, even mental issues like schizophrenia,
Interesting.
achondroplasia, that's dwarfism, and all that are common in sperms of men at an older age. So the children can have genetic abnormalities too. And then even the children are also predisposed to some certain types of cancers. So you see, like brain cancers, leukemias are also more common in these children.
Okay.
Yeah.
Oh, that's interesting. So that was just a general overview. I want us to go into segments. Let's talk about the women again. Let's
Yeah.
go into a deep dive with women. You mentioned the ovarian reserve. That's
Yes.
how many eggs a woman is, born with. So how does age affect the quality of this ovarian reserve? Yes.
So age not just does not just affect the quality, also affects the number.
the number.
So
Okay.
like
The
I
amount
said,
too,
a woman
yes.
is born. When a woman is born, you have about 1 to 2 million eggs. By the time the woman is entering, the lady or young lady is entering puberty, the quantity has decreased to about 300 to 400,000.
It's a lot.
Yes, and like I said, with each menstrual cycle, so for a woman that's menstruating regularly, you might have about 12 to 13 menstrual cycles in a year, depending on the length of your menstrual cycle.
Yeah.
Each menstrual cycle, about 1,000 eggs start to develop, but only one continues to mature and is ovulated. So like 999 gets destroyed,
Basically, yeah.
to use that term. So imagine, so you can see how
And there's no
the
regeneration of that.
exactly, there's no regeneration. So you can see the decline in the number, the rapid decline in the number of eggs. And then as a woman is, these are the same eggs that have been in the ovaries even before the child was born. Right from when a female child was in utero, these eggs were in the ovaries. So they are aged, they are old, they've aged. So they tend to have a lot of
Already
chromosomal
grown.
abnormalities. So even when pregnancy is achieved with them, the chances of giving birth to a child with some genetic abnormalities is high. And then because these eggs are abnormal, chances of fertilization taking place is low. Chances of a pregnancy happening is low.
No.
Yes, so that's some of the ways that aging affects the woman.
Okay. Yeah. I was, going to ask about that too, because some people have brought about the topic of how common it is, or the increased risks of miscarriages in,
Okay.
older women. So, how does the age affect
Yeah,
that
so
conception to birth process of a, older woman?
when, yes, so it just has to do with the kind of eggs. If the eggs are normal, the tendency of a miscarriage happening is less. But when the eggs have chromosomal abnormalities already, even when fertilization happens, the chances of fertilization is less. But and even when it happens, this embryo that is formed has some chromosomal abnormality. A lot of them are not compatible with life. So nature, the body tries to get rid of it. And that's
Oh.
the process of miscarriage, how miscarriage, because the body knows that this baby is born, the chances of this baby surviving is very
Very
low.
low.
So nature just wants to knows that this is abnormal, and nature just wants to get rid of that embryo, and that's what leads to the miscarriage. So the chances of miscarriages are high.
So the
So a lot of
quality.
spontaneous miscarriages is due to chromosomal abnormalities in the embryos. It's just
Okay.
nature's way of getting rid of those kind of babies.
So this also has to do with, the quality of the eggs that are being
Definitely the
produced,
quality,
like
yes, it has to do.
it matters a lot
Yeah,
when,
egg
we're
quality is
talking
very
about.
important. Yeah, it's not just number. Egg quality. If you have one good quality egg, it can give rise to a pregnancy.
Wow.
But if you have 10 poor quality eggs, chances of pregnancy happening is very low.
Okay.
Yes.
So, you spoke about hormonal changes and menstrual cycle, and, how that affects the fertility of a woman as we grow. Can you go a little bit more into that? You spoke about follicular
Stimulating
stimulating hormones.
hormone,
Okay,
yes.
yes. So, can
Yes.
you make that a little bit easier for us to
Yeah, so
understand? Yes, ma'am.
the menstrual cycle, what we see is the menses. That's
Yeah.
the blood that a woman, the blood flow from the vagina the woman has every month. Most women have every month. Yes, so that's just one of the outward signs of the menstrual cycle. But this menstrual cycle is controlled by hormones. Hormones are substances produced by certain organs in the body that go to have an effect on other organs in the body. So that is what regulates. So there are lots of hormones involved in this menstrual cycle. For a woman to menstruate regularly, there are
Yeah.
hormones involved. Yes, and one of the hormones, or two of the hormones, are produced by the ovaries, the estrogen and progesterone. Those are the major female hormones.
Okay, so like you said, the ovaries are what house the eggs,
Eggs,
right?
yes,
Okay, so just so
the
we're
ovary
clear
is the
with that.
organ, so the eggs are in the ovaries. So these major female hormones are produced by the ovaries, the estrogen and progesterone. So when a woman is tending, aging, as a woman ages, the function of the ovaries starts declining. So the ovaries is not producing eggs. So these hormones are not produced. The estrogen, progesterone are not produced.
Produced.
Yes. So the body senses that there's a decline. So there's an organ in the body, in the brain, that is stimulated to produce this FSH and LH I talked about, that
Okay.
is supposed to act on the ovaries to make the ovaries produce eggs. But the function of the ovaries has waned. The ovary is not responding. So body keeps producing a higher amount of this follicle stimulating hormone, luteinizing hormone, as
And
a
there are
way to,
no,
yes, to
it
cause the ovaries
has
to
no
produce.
effects.
Yeah, but the
Yeah.
ovary is not functioning. So when you have high levels, in fact, when you measure high levels of this follicle stimulating hormone and luteinizing hormone in a woman's blood, it's one of the signs tells you that this woman is perimenopausal or even menopausal.
Sorry, what do you mean by
Okay, so
perimenopausal?
perimenopausal is that period before
Before
the menses
menses.
ceases. The period, and that period is characterized by irregular menses. The menstrual cycle can become haphazard. The flow can become less. It can even become more prolonged and all that. A lot of changes. This woman starts having some symptom hot flushes, and this because the body is not able to regulate temperature effectively. The woman will just feel a hot wave, intense heat will just come upon her, and then she's sweating excessively. And this because of these fluctuations
in
the hormones that we're having. Yes,
Okay.
other symptoms like vaginal dryness, decreased libido, the woman osteoporosis. A woman has a she's predisposed to having fractures if she's not careful,
Oh wow.
because
Okay.
estrogen helps to retain the structure of the bones.
So it's not just effective in our reproductive
No,
system.
so this aging, like I said, aging
Yeah.
affects all body organs.
Wow, that's
Yes, it
interesting.
affects all
That's
the
very
body
interesting.
organs. Yes,
Okay, thank you so much for telling us more about that, about women. We've spoken about, the ovarian reserve, we've spoken
yes.
about hormonal changes, we've spoken about the quality of eggs. Now let's flip to the men, the men's side. I mean, I have heard of sperm count.
Yes. Yeah.
So can you tell us how the man can affect this thing called a sperm count, or even explain to us a little bit about the sperm count is?
So the sperm count is the amount of sperm cells. The seminal fluid has the sperm cells and other substances. So the sperm cells, those are the spermatozoa. Those are the male gametes that go to fertilize the eggs.
Okay.
So there's a number that you should have in the amount of seminal fluid. Yeah, with age, count might not totally decline, except there are other issues, other comorbidities, but the volume usually declines. And I talked about the motility of the sperm also declining.
Yes.
Yeah, but the effects you have, on
Thank you for sticking around. Sorry about that. There was a bit of a network interruption, but we'll go right ahead. We've seen some questions from you in the comment section. Thank you for engaging to answer that, to answer your questions. So, Dr. Deborah, we have a question from Chioma on Facebook.
All right.
She asked about what aged couples can do when they're trying to get pregnant, because we're talking about all the negatives about age. So, what can we say? What can they do to, achieve pregnancy or achieve conception?
Right. So, for couples that advance the age, we would counsel that they should do pre-genetic implantation testing, so that when the gametes are collected from them, for example, so an IVF will be counseled, we advise they have an IVF, so that when the embryos are genetic, will be tested. That's what pre-genetic implantation testing does. Testing is done on these embryos to rule out abnormalities. So the abnormal embryos, are so that when an embryo transfer is done, it's not done with these abnormal embryos, and that would reduce the chances of having children with genetic abnormalities.
And then how about the men as well?
Okay.
What can we say? What can we advise? In the process of what are some things that we would see that would counsel them more about? Like you said, there's the motility, there's abnormalities,
morphology abnormalities.
So these are things that we would, inform them about.
So when they come for an IVF, we usually do a seminal fluid analysis. That's a test to look at the sperm. And when we notice some of these things, there are further testings we could do, like the DFI, DNA fragmentation index, that will give us more information about the amount of abnormal DNA fragments in this sperm. So we can counsel them based on that.
So you can kind of, pick the healthiest, or should I say sperm prior to actually implanting.
But it's sometimes, just by looking at the sperms, you might not really be able to say those that are healthy. That's why I talked about the pre-genetic implantation testing.
So you have a better chance of knowing what, we might expect.
The constituent DNA, exactly, the genetic material.
Thank you for that. We have another question. Thank you so much for sending in these questions, and I'm sure Dr. Deborah would love to answer these questions. From Joy, she says, what happens when a woman's right ovaries, specific question, wow, right ovaries are silent during a TVS? Now you have to be really deep into this to know TVS. So for people who do not know what a TVS means, can you first of all start with that?
TVS is just an acronym, short scan. So this is a scan done with a transvaginal probe. So the probe goes through the vagina so that you get possible to the ovaries, the uterus, to be able to look at them. So this Joy's question about how ovaries are silent. Well, if the ovaries are silent at particular times in the woman's menstrual cycle, we're happy about it. So it shows no cysts. So I don't know what period of her cycle her ovaries were silent and what her doctor said. But she can always come into the hospital and then we can check that more.
So it depends on what time of the cycle it is. So it's not just silent at all times.
No, there are times that the ovaries are quiet. That's the other word we use. That means there's no follicular activity. There are no cysts in the ovary, and that could be good at a particular time of a woman's menstrual cycle.
This is your question, Joy. We've said so much about age and its effects on fertility, and it's a very interesting topic. I mean, like I said earlier on, women's fertility is a very common topic of discussion in society when it comes to her age. Thank you so much, Deborah, for sharing your insight with us. Like I said, she's an expert in this field, so I'm sure you've been well informed on this. Thank you so much for joining us once again. We continually appreciate your engagement. We continually appreciate you coming with us. We have multiple social media platforms. Yes, I know. We have TikTok, we have a Facebook, we have an Instagram, we have a YouTube channel. I mean, there's a lot that we have. And I hope that this session has been informative to you and that you're leaving with more in your mind, or you're leaving with more ease about this topic and how your age can impact fertility. If you're new here, thank you for joining us. Thank you for staying until the end. I really hope that you will come back for another session, which is why I mentioned our social media platforms. Please do well to go on there and check us out. You can turn on your post notifications. That will remind you about the next session that we're going to have. So you don't forget, and then you can join us next time. It was lovely having you. Like I said, we appreciate you all the time. See you around. See you next time. Bye.